These days, it seems like CNN is trying to alienate literally everyone who has any interest in watching or reading mainstream news media. They never really cater to conservatives from the get go, even though they had a somewhat stable facade of a balance between left and right during the 1990s, back when they reported news more objectively. Of course, when presidential candidate Donald Trump came along, everything changed, and they, along with other mainstream liberal networks, overdosed on rage pills, hair on fire pills, screaming pills, and matrix dwelling blue pills. And that seemed to be the status quo for about a decade at this point. They abandoned anyone who remotely views anything through a conservative lens, and they went hardcore left wing progressive, or at least so I thought, until I came across a particular article that I wouldn't expect CNN, of all people, to publish. This is an article discussing the risks associated with marijuana use, including potential death from heart attacks and strokes. Now, with this being a scientific study of sorts, the word politics shouldn't need said, as this isn't really a political issue. However, CNN is dying from a lack of viewers and traffic, and you would think that, since progressives tend to support and even partake in cannabis use, CNN would simply look the other way regarding this marijuana study. But they didn't, which is honestly a bit surprising to me. Conservatives aren't showing up to CNN at all these days, and the few progressives who still care, they probably aren't going to overwhelmingly read this article, nor will they probably agree to it, as liberals often believe there is no possible way marijuana can lead to death in any way, shape, or form. So this comes from CNN Health. Marijuana use dramatically increases risk of dying from heart attacks and stroke, large study finds, and it was a large study which involved multiple countries in this study. So, using marijuana doubles the risk of dying from heart disease, according to a new analysis of pooled medical data involving 200 million people, mostly between the ages of 19 and 59. So, they weren't kidding when they said it was a large study. That's a lot of people. Quote, what was particularly striking was that the concerned patients hospitalized for these disorders were young and thus not likely to have their clinical features due to tobacco smoking and with no history of cardiovascular disorder or cardiovascular risk factors, said senior author Emily Joannis, an associate professor of pharmacology at the University of Toulouse, France, in an email. Compared to non-users, those who used cannabis also had a 29% higher risk for heart attacks and a 20% higher risk for stroke, according to the study published Tuesday in the journal Heart. So that's fairly substantial for heart attacks and also pretty decently substantial for strokes, especially in America where smoking isn't really the primary cause for cardiovascular disease, heart disease, strokes, heart attacks. I mean, it's really the food we eat. It's ultra processed food and tons of sugar and tons of just junk that we eat all the time, which contributes to this. So most people who smoke weed all day, they're probably not eating the healthiest of all foods. They're probably eating stuff like, Funyuns and chips and just stuff that you'd get from the shelves of a convenience store for the most part. So, quote, this is one of the largest studies to date on the connections between marijuana and heart disease, and it raises serious questions about the assumption that cannabis imposes little cardiovascular risk, end quote, said pediatrician Dr. Lynn Silver, a clinical professor of epidemiology and biostatistics at University of California, San Francisco. Quote, getting this right is critically important because cardiovascular disease is the top cause of death both in the United States and globally, said Silver, who is also senior advisor at the Public Health Institute, a nonprofit public health organization that analyzes marijuana policy and legalization. Silver is the co-author of an editorial published with the paper that calls for change in how cannabis is viewed by health professionals, regulatory bodies, and the public at large. Quote, let's see here. So, quote, clinicians need to screen people for cannabis use and educate them about its harms, the same way we do for tobacco, because in some population groups, it's being used more widely than tobacco, she said. And that's probably fairly widespread these days, in my honest opinion. I mean, I still see people smoking in traffic. I still occasionally see someone walking around with a cigarette, but I mean, nothing like I did 10, 20, 25 years ago. It's gone way down. I don't know what the statistics are for tobacco use, but I'm sure it's fallen quite sharply over the last 10, 15 years. You could probably attribute a lot of that to vaping, honestly. I mean, I used to smoke. I smoked for 16 years. I started when I was 14 years old, daily. Smoked every day since I was 14 all the way up until I was about 30. Then I discovered vaping, and yeah, it's not good for you either. It can lead to cardiovascular issues also. I understand that. It's better than smoking. I know a lot of people don't like to hear that, but it is true, and I get it that the the vape juice contains seed oils, which is also not good for you. So yes, I totally get that. Um, I may consider quitting that at some point. I probably should consider that, right now. But nicotine, it's a hell of a monster. It really gets a hold of you in very surprising ways. It's crazy hard to quit. I mean, yeah, it's one of the most difficult things to quit. I mean, it was easier to quit alcohol, drinking daily, to be honest. I mean, I drank 3 to 4 beers a night for, I don't know, at least a few years, 4 or 5 years, something like that. And I gave it up cold turkey. I had a few rough nights. I wasn't binge drinking, a case of beer or a fifth every night. So, I wasn't dealing with that level of an issue. But I mean, it wasn't that easy to quit, but it sure as hell was a lot easier than quitting nicotine. That one's been a beast that I've not been able to overcome, at least not just yet. So anyway, clinicians, let's see. I think I already read all that. Yeah, okay. So our regulatory system, which has been almost entirely focused on creating legal infrastructure and licensing legal for-profit businesses, needs to focus much more strongly on health warnings that educate people about the real risks. Which, of course, if you talk to left wingers, progressives, hippies, and probably even some conservatives or independents who smoke weed on a regular basis, they'll tell you, no, marijuana, it's not even really a drug, man. It's not bad for you. It's the smoke is perfectly fine for you. No, dude, at the end of the day, it's a carcinogen. It's smoke, man. You're breathing in smoke. It's not good for you. So as far as taking edibles or things like that when you're not smoking marijuana, I'm not so sure. We're not done with the article yet, but I'm hoping that they bring that up because there's more than one ways to consume marijuana or THC. So the dangers of smoke and maybe edibles. So right off the bat, they're already mentioning edibles, so it's possible. The new systematic review and meta-analysis analyzed medical information from large observational studies conducted in Australia, Egypt, Canada, France, Sweden, and the US between 2016 and 2023. Those studies did not ask people how they used cannabis, which is a problem. I don't know why they wouldn't have asked that, such as via smoking, vaping, dabbing, edibles, tinctures, or topicals. Dabbing involves vaporizing concentrated cannabis and inhaling the vapor. So it's not smoke, it's vapor, not the same thing. However, based on epidemiological data, it is likely that cannabis was smoked in the vast majority of cases. Yeah, I would absolutely agree with that. I think probably the overwhelming majority of people who partake in cannabis use, they're definitely smoking, I'm sure. Smoking tobacco is a well-known cause of heart disease. Both the smoke and the chemicals in tobacco damage blood vessels and increase clotting, according to the U.S. Centers for Disease Control and Prevention. That's a given. Therefore, it is not surprising that smoking, vaping, or dabbing cannabis could do the same, Silver said. Silver said, any of the many ways of inhaling cannabis are going to have risks to the user, and there's also secondhand smoke risks, which are similar to tobacco. Now, full stop, THC or marijuana, I would assume, generally speaking, doesn't have the 5,000 plus chemicals in the smoke that tobacco tends to have. I mean, I don't know where all those 5,000 chemicals come from. For all I know, it's just propaganda that's not even true. I'm assuming it's true. They've been saying it for decades, and there's been very little pushback against that. I assume it's probably coming from a slew of pesticides that they use and probably the processing process that goes into making tobacco, but I don't know. I'm no expert on it, and honestly not sure, but I'm guessing that there's probably way fewer chemicals in cannabis than there tends to be in commercial tobacco. But don't quote me on that because I'm not 100%. I'm just assuming. The notion that smoking cannabis is less harmful because it's natural is just wrong. Dr. Beth Cohen, professor of medicine at the University of California, San Francisco, told CNN in a prior interview, when you burn something, whether it is tobacco or cannabis, it creates toxic compounds, carcinogens, and particulate matter that are harmful to health, Cohen said in an email. Probably bad for your lungs as well. of course. However, edibles may also play a role in heart disease, according to a May 2025 study. People who consumed edibles laced with tetrahydrocannabinol, or THC, damn, I'm glad I got that right. At least I think I did. Let's see, it showed signs of early cardiovascular disease similar to tobacco smokers. I'm not a maestro with the English language thoroughly, so whenever I get a tough word out, I kind of praise myself. I'm gonna give myself a gold star. We found that vascular function was reduced by 42% in marijuana smokers and by 56% in THC edible users compared to non-users. Dr. Lila Mohammadi, an assistant researcher in cardiology at the University of California, San Francisco, told CNN in a prior interview. My apologies to anybody whose name I don't pronounce correctly. I also have a name that is difficult to pronounce. People get it wrong all the time. Probably 1 in 50 people actually pronounce my name correctly. So, I'm constantly subjected to the same thing. So my bad. Anyway, the danger of high potency weed. None of the studies included in the new meta-analysis asked users about the potency of THC in the products they consume. Even if they had, that information would be quickly outdated, Silver said. The cannabis market is a moving target. It is getting more potent every day, she said. Yeah, that is true. I mean, they're constantly jacking up the potency, not just from THC, but for everything. I mean, look at fentanyl. Fentanyl is like, what, 10,000 times stronger than morphine? Something like that. It's absolutely insane. It's crazy what they're doing in the lab these days. So, quote, what's being sold to people today in California is 5 to 10 times stronger than what it was in the 1970s. Concentrates can be 99% pure THC. Vapes are over 80% THC. Damn, I didn't know they were that strong. A variety of chemically extracted cannabinoids can be almost pure THC, and all of these just have a very different effects. All of these have very different effects on people than smoking a joint in the 1970s. Higher potency weed is contributing to a host of problems, including an increase in addiction. Uh-oh. Oh no, they used the big A word. CNN, what is wrong with you, man? You are alienating your base. You're pushing them away. They do not want to see the A word associated with the THC acronym. That is a big no-no, but whatever. I guess we'll just let them deal with that on their own. So, a July 2022 study found consuming high-potency weed was linked to a 4-fold increased risk of dependence. Oh no, the D word too, dependence. Uh-oh. In the United States, about 3 in 10 people who use marijuana have cannabis use disorder, the medical term for marijuana addiction, according to the CDC. Good grief, man. They are hitting the trifecta. Now it's cannabis use disorder. Quote, we know that more potent cannabis makes people more likely to become addicted, Silver said. We know that more potent cannabis makes people more likely to develop psychosis. Oh, yikes. Seeing and hearing things that aren't there, or schizophrenia. Habitual users may also suffer from uncontrollable vomiting. See, this is all new news to me. I mean, I've never partaken in any of this 99% whatever. I mean, I've not enjoyed THC since high school. I know that is a big time cliche, but it's true. I mean, it is what it is, at least in my experience. I mean, yeah, back when weed was probably similar to what it was in the 1970s, where you pay extra money, you get better weed. If not, you get, brick packed Mexican weed for the most part, or Latin America. I'm sorry, didn't mean to say Mexican, Latin American, because I truly don't know where the weed came from. Could have come from anywhere south of the border. So anyway, the rise in potency is one reason that the current study may not have captured the full extent of the risk of marijuana for heart disease. Wanjis said, we are afraid that the association might even be stronger than that reported. While science continues to study the risk, experts say it's time to think twice about the potential harms of cannabis use, especially if heart disease is a concern. Quote, if I was a 60-year-old person who had some heart disease risk, I honestly, full stop, I would assume that anybody who's 60 years old probably has a heart disease risk, but that's just me. I'm no doctor. She's the doctor, or he or she. They're the doctor. I'm not. I've seen older people who are using cannabis for pain or for sleep, some of whom have significant cardiovascular risk, or who have had strokes or have had heart attacks or had angina, and they have no awareness that this may be putting them at greater risk, end quote. So what would you suggest that they do? What should they do? Should they go get hooked on big pharma, take other medications that they'll get physically addicted to? I mean, if they're smoking weed because it helps with pain, the alternative to that, at least as far as big pharma is concerned, is to get put on prescription opioids, such as hydrocodone, oxycodone, Percocet, which is oxycodone, or uh, like morphine, hydromorphone, fentanyl. I mean, it gets more extreme as you go on, but is that better? I mean, it might be better for your heart, maybe, because when you take opioids, it slows down your heart rate. I mean, it's not good when you OD because it will kill you, absolutely will, and it does. It kills tens of thousands of people every year, especially with fentanyl. But I mean, anything is going to cause a problem. Even coffee, they sometimes they say it causes cancer, other times they say it's got tons more benefits than it has risks. Same with eating like dark chocolate. Sometimes they say it's amazing for you, other times they say it's going to kill you if you keep doing that every day. Same with drinking a glass of red wine a day. Sometimes it's awesome, sometimes it's perfectly healthy, other times it's damaging to your entire human body. So, I mean, I don't know, man. It's to each his own. And if you're 60 and if it's helping you day by day, of course, you should talk to your doctor regardless. They should at least know that you are partaking in cannabis use. If I were their doctor and I heard that news, and if I actually knew more than I actually know about medicine, which is almost nothing, I would probably tell them, don't smoke it and don't vape it either. And don't do that other, whatever that thing was called, which involved vaping it, dabbing. I would just say, get an edible, get gummies, something like that. And if you have kids around, don't get any gummies that look enticing at all. Don't get like cotton candy and gummy bears and all that ridiculousness. I mean, should it be illegal? No, I don't think, making gummies and candies with THC should be illegal per se, but it really shouldn't be marketed with brightly colored packaging and almost cartoonishly. Some of these packagings, they look like they're catering directly to kids, and that's not good. Obviously, that's not good. Not really saying that it should be outright illegal. I'm just saying, if you got children around in your life, you probably shouldn't be getting that stuff. You should get some other kind of edible that is, way more on the down low. But anyway, yeah, so this article, CNN Health, very interesting. It was very surprising to me that of all people, CNN. Now I know that they have the health division, so they've got articles with regard to healthcare and everything on the CNN website. But either way, I would have just assumed that they would have taken a look at this article and just simply said, "Nah, I think we're going to pass on that one. We're not going to go one way or the other. We're just going to, just pretend that article just didn't happen." But I mean, maybe all the other mainstream outlets are running that article. I would assume they probably are, especially if 200 million people were involved in that study. If that number is accurate, that's an enormous study. It's one of the largest studies I think I've ever heard in the medical field. But anyway, so that's all I got. So take it, any way you want to take it, whether if it's good for you, bad for you, if it really does cause stroke and heart attacks. I mean, all I did was just read what they said. I've always heard that it wasn't as bad for you as they make, smoking cigarettes, for example, out to be. But yeah, I mean, times are changing. Technology is getting better. 200 million people were studied, so there's got to be something to it if they're indeed sticking strictly to the science. And being CNN, I mean, if they believe them, then it seems pretty legit, because this whole study, it kind of goes against the narrative that THC is in more ways healthier for you than it is harmful. So anyway, that's all I got. Thanks for watching, and see you later.